Welcome back, future nurses. Today, we will cover another power-packed NCLEX prep session. As you all know, every single day in this series, we're covering 2 to 3 high-yield topics, along with practice MCQs that sharpen both your knowledge and exam strategy. Today, we are moving into a high-yield NCLEX topic that often challenges students under pressure: disaster nursing and triage. Now, unlike our usual hospital setting where the goal is to provide the best care for each individual patient, disaster nursing shifts your focus entirely. Instead, the priority becomes providing the greatest good for the greatest number of people. This means you will need to think quickly, prioritize limited resources, and make life-saving decisions. Let us go step by step so you feel confident tackling this both in the exam and in real life. But before we dive into today's lesson, let me share something exciting. We've launched our complete NCLEX review crash course, already trusted by over 10,000 students who cleared NCLEX on their first try. Here's what you get when you enroll. Live daily classes with expert guidance, 500+ hours of recorded lectures for anytime revision, 100+ hours of animated crash lessons to simplify tough concepts, 5,000 NCLEX-style and previously asked questions, 15 CAT mock tests in real NCLEX format, Next-Gen NCLEX question practice pack, detailed lectures plus PDF notes plus NCLEX ebook, and so much more, all in one place. Right now, you can grab this entire package at a massive 70% discount, but only for a very short time. Click the WhatsApp link in the description to claim your free 5-day trial and start your NCLEX journey today. And don't forget, you can also join our Telegram channel for extra free practice questions. Link is in the description too. What is disaster nursing? To begin with, disaster nursing is the application of nursing knowledge and skills during natural or man-made disasters to save as many lives as possible. Here, flexibility and critical thinking become your strongest tools. Unlike routine care, where you may care for only a few patients, in a disaster, you may be faced with hundreds of victims all at once. And this is exactly why triage becomes the cornerstone of disaster nursing. Types of disasters. Now, let us break down the types of disasters you may encounter. First, we have natural disasters such as earthquakes, floods, hurricanes, wildfires, and even pandemics. Next, we move into man-made disasters, which include bomb explosions, chemical spills, mass shootings, and transportation accidents. And finally, there are complex disasters, where both natural and man-made elements combine. For example, an earthquake causing a chemical plant explosion. Here is an NCLEX Pearl for you. If the disaster involves chemicals or biological agents, decontamination always comes before hospital treatment. Phases of disaster management. As we transition into the broader cycle, disasters are managed in 4 phases. First is mitigation, which focuses on prevention, such as building levees to reduce flooding. Second is preparedness, where drills, emergency plans, and stockpiles are created. Third comes the response phase, which is where triage, rescue, and life-saving interventions occur. And finally, we reach the recovery phase, where long-term rebuilding, counseling, and community restoration take place. And remember, if the NCLEX asks what the nurse should do during the actual disaster, the correct phase is always response. Role of the nurse in a disaster. Moving forward, what exactly is your role as a nurse in such situations? First and foremost, you must ensure your own safety. If the scene is not safe, you cannot help others. Next, you will be expected to use proper personal protective equipment, perform triage, and provide rapid stabilization. Beyond physical care, you also offer psychological support, act as a communicator, and advocate for victims. Here is another NCLEX Pearl. If you are the first nurse to arrive on scene, your initial action is to make sure the environment is safe before beginning patient care. Triage in disasters. Now let us transition into the heart of this topic, triage. Triage is the process of sorting patients based on severity and survival potential. The most widely used method is the START system, simple triage and rapid treatment. This system uses the RPM method for a quick under 60-second evaluation. R for respiration. Is the patient breathing? P for perfusion. Check circulation, pulse, or capillary refill. M for mental status. Is the patient alert, confused, or unresponsive? Triage color categories. As we continue, here are the 4 color-coded categories you must master. Red tag, immediate. Life-threatening but survivable with rapid treatment. Think airway obstruction, severe bleeding, or shock. Yellow tag, delayed. Serious but stable enough to wait. For example, burns without airway involvement or large fractures with stable vitals. Green tag, minor. Also called the walking wounded. These are minor injuries like small cuts and sprains. Black tag, expectant dead. No respirations after airway repositioning or injuries incompatible with life, such as massive head trauma. NCLEX, Pearl. In everyday nursing, you would start CPR for a patient with no pulse, but in disaster nursing, that patient is a black tag. Resources must go to those most likely to survive. Key nursing priorities in triage. So, how should you think as a nurse performing triage? Always start with airway. Repositioning an airway can move a patient from black to red instantly. Next, control major bleeding with direct pressure or tourniquets. Then, prevent shock by keeping the patient warm and elevating legs if possible. And most importantly, do not spend more than 1 minute per patient. Special triage considerations. Let us now transition into special populations. For children, we use jump start triage. If they are apneic, you give 5 rescue breaths before assigning a black tag. For pregnant women, you stabilize the mother first because her survival ensures the best chance for the fetus. In chemical or biological disasters, remember decontamination before medical care. And with the elderly or immunocompromised, still apply START, but anticipate greater risks. Ethical issues in disaster. Nursing. Next, let us address the ethical side. Nurses may face situations where care must be withheld from patients unlikely to survive. This can be emotionally challenging, but the ethical principle guiding disaster nursing is utilitarianism, doing the greatest good for the greatest number. Let me take a quick pause. We've launched our complete NCLEX review crash course, already trusted by over 10,000 students who cleared NCLEX on their first try. Here's what you get when you enroll. Live daily classes with expert guidance, 500+ hours of recorded lectures for anytime revision, 100+ hours of animated crash lessons to simplify tough concepts, 5,000 NCLEX-style and previously asked questions, 15 CAT mock tests in real NCLEX format, Next-Gen NCLEX question practice pack, detailed lectures plus PDF notes plus NCLEX ebook, and so much more, all in one place. Right now, you can grab this entire package at a massive 70% discount, but only for a very short time. Click the WhatsApp link in the description to claim your free 5-day trial and start your NCLEX journey today. And don't forget, you can also join our Telegram channel for extra free practice questions. Link is in the description too. Let us now shift gears into practice and test your understanding with some NCLEX-style multiple-choice questions on disaster nursing and triage. I will read each question, walk you through the options, reveal the correct answer, and then explain why each choice is right or wrong. Stay with me, because these questions are designed to sharpen your exam skills. Question 1. Imagine you are triaging victims after a bus accident. Which client should be tagged as red or immediate priority? The options are A. A child with a fractured arm and stable vital signs. B. An adult with agonal respirations and no pulse. C. A teenager with stridor and severe respiratory distress. Or D. An older adult with minor abrasions walking around. The correct answer here is option C, the teenager with stridor and severe respiratory distress. This is because airway compromise is immediately life-threatening but treatable. So they need urgent care. Option A is only a fracture with stable vitals, which makes them a delayed or yellow tag. Option B is no pulse and agonal breathing, which is not salvageable and therefore a black tag. Option D is walking with abrasions, which is clearly green or minor. Question 2. Moving to the next scenario, during a mass casualty event, which patient would receive the lowest priority for treatment? The options are A. A client with a head wound and a Glasgow coma score of 15. B. A client with abdominal bleeding but stable blood pressure. C. A client with no respirations even after airway repositioning. Or D. A client with burns covering 25% of the body surface area but stable vitals. The correct answer is option C, no respirations after airway repositioning. This meets the criteria for a black tag because survival is not possible with limited resources. Option A is a stable head wound, which fits yellow. Option B is abdominal bleeding but stable vitals, which can also wait and is therefore yellow. Option D involves burns but stable vital signs, which also places them in yellow. Question 3. Now let us apply the START system. A patient has respirations of 28, capillary refill under 2 seconds, and they are able to follow commands. Which triage color is appropriate? Your options are A, red, B, yellow, C, green, or D, black. The correct answer is option B, yellow. Since respirations are less than 30, perfusion is normal, and the patient is responsive. This makes them delayed but stable. Option A would only apply if respirations were above 30 or perfusion compromised. Option C is incorrect because this patient is not walking wounded. Option D is also incorrect because the patient is alive and following commands. Question 4. Let us continue with an earthquake scenario. Which victim should be tagged green or minor? A. A client with superficial scratches who is able to walk. B. A client with absent breath sounds and cyanosis. C. A client with unstable pelvic fracture and shock. Or D. A client with a chest wound and severe bleeding. The correct answer is option A, the patient with scratches who is walking. This clearly meets the green or minor category. Option B has absent breath sounds and cyanosis, which is airway compromise and should be red. Option C involves shock with an unstable fracture, which again is red. Option D is severe bleeding, which is also immediate and therefore red. Question 5. Next, let us bring pediatrics into the picture. A nurse encounters an apneic child after a building collapse. What should be the next step according to Jumpstart? Is it A, tag the child black immediately, B, provide 5 rescue breaths, C, start chest compressions, or D, tag the child green? The correct answer is option B, provide 5 rescue breaths. Children are given special consideration because respiratory arrest may be reversible. Option A is incorrect because we do not tag them black until rescue breaths fail. Option C is incorrect because chest compressions are not part of triage. Option D is incorrect because an apneic child is never considered minor. Question 6. Now imagine a pregnant woman injured in a car crash during a mass casualty event. What is the priority? A. Assess fetal heart tones first. B. Stabilize the mother's airway and circulation. C. Place the mother on her left side. Or D. Call obstetrics for immediate delivery. The correct answer is option B. Stabilize the mother's airway and circulation. Maternal survival is always the top priority because the fetus cannot survive without the mother. Option A is important but comes later. Option C is helpful positioning but not the first step. Option D, calling for delivery, is not appropriate during triage. Question 7. Shifting into chemical disasters. After a chemical spill, victims arrive at the hospital. What is the nurse's very first action? A. Begin oxygen therapy immediately. B. Start IV access for rapid fluids. C. Perform decontamination before entry. Or D. Place patients in negative pressure rooms. The correct answer is option C. Decontamination before entry. This prevents secondary contamination of healthcare workers and facilities. Option A is airway support, but only after safety is ensured. Option B is also necessary, but comes after decontamination. Option D is incorrect because negative pressure rooms are for airborne infections, not chemicals. Question 8. During triage, which client should be tagged as black or expectant? A. A patient with no respirations after airway repositioning. B. A femur fracture with stable vitals. C. Burns covering 15% body surface area with a stable airway. Or D. Stridor with oxygen saturation of 80%. The correct answer is option A, no respirations even after airway repositioning. This indicates no survival potential. Option B is yellow because the fracture is stable. Option C is also yellow because burns are moderate but stable. Option D is airway compromise, which is red. Question 9. Let us now discuss ethics. Which statement best reflects the guiding principle of disaster nursing? Is it A, always provide CPR to those without a pulse? B, focus on saving the most salvageable patients? C, treat the youngest patients first? Or D, use family preference to guide triage decisions? The correct answer is option B, focus on the most salvageable patients. Disaster nursing is based on utilitarian ethics, meaning the greatest good for the greatest number. Option A is incorrect because CPR is not done in mass casualties for black-tagged patients. Option C is incorrect because age is not the deciding factor. Option D is incorrect because triage decisions are clinical, not based on family requests. Question 10. And finally, let us test your ability to classify delayed patient. Which of the following is a yellow tag? A. Multiple abrasions, alert, and walking. B. Severe head trauma with no response. C. abdominal wound with stable vital signs, or D, respiratory distress with the stridor? The correct answer is option C, abdominal wound with stable vital signs. This is serious but can wait, which is yellow. Option A is green because they are walking wounded. Option B is black because survival is not possible. Option D is red because stridor is airway obstruction. So there you have it, 10 high-yield NCLEX questions with detailed reasoning that show you exactly how to apply disaster nursing and triage principles. Notice how each question forces you to think critically about airway, breathing, circulation, and survival potential. By practicing these scenarios, you train yourself to quickly identify priorities, just like in the real exam.